Welcome to Under the Surface, where we explore aesthetics and the trends shaping beauty and culture. I'm your host, Dianna Singh, Features Director at Allure. Today, we're exploring one of the most popular and ever-evolving treatments in aesthetics, filler. Techniques and formulations have advanced over the years, so it's helpful to understand what's right for you and what kind of results to expect. With that being said, to guide today's conversation, we have Dr. Claire Chang, a board-certified dermatologist. Dr. Chang, thank you so much for joining us today. Let's start with the basics. When people hear the word filler, there's a lot of mystery surrounding that word. Dr. Chang, could you break it down for us?
Absolutely. Fillers are injectable treatments that can add temporary volume in areas we have lost volume, give structural support to specific areas like our chin, smooth moderate to severe facial lines and folds, and enhance certain facial features like the lips. The most commonly used fillers today are made with a modified form of hyaluronic acid, or HA. You may have heard of HA. It's a common ingredient in skincare products. Yes. HA is actually a naturally occurring substance in the skin that's known for attracting and retaining moisture, which keeps the skin moisturized and soft.
So the HA in our bodies, the HA in filler, same thing?
Great question. The HA in fillers, like those in Juvederm, is modified and designed to be injected beneath the skin to add volume to specific areas of the face for smooth, natural-looking, and temporary results. Over time, the body gradually breaks HA down, which makes HA fillers a non-permanent option.
And are all HA fillers the same then?
Many people don't know this, but there are more than one type of HA filler. There are different brands of fillers and multiple different types of fillers within each brand. Some fillers are formulated differently depending on the area of the face they're designed for. The JUVÉDERM Collection, for example, has specific products that can temporarily add volume to different areas of the face, like the lips, the cheeks, and the jawline.
Wow, so much to learn. Thinking about treatment and what to know before consulting with a licensed specialist, what are some of the common side effects of fillers that patients should be aware of?
The most common side effects with injectable HA fillers are bruising, redness, swelling, pain or tenderness, firmness, lumps, bumps, discoloration, and itching. Most side effects are mild to moderate and last for 30 days or less. If you have any concerns before treatment, it's always best to discuss them with your licensed specialist. That's what we're here for.
You've mentioned Juvederm a few times now. Can we go deep on their product range? Because I understand it's quite broad, right?
It is. I love how versatile the JUVÉDERM collection is. There are actually 6 unique JUVÉDERM fillers that are FDA approved to treat 7 different areas of the face. JUVÉDERM VOLUMA XC, for example, is used to temporarily add volume to the cheeks, the temples, and the chin.
Wow, so how does an injector like yourself choose which one to use, where to use it, and in what amount?
That's where art and science meets a little. The injection technique, the placement, and product choice all matter. And this is why working with a licensed, trained injector is so important. They assess the face in totality, discuss treatment goals with the patient, and map out a treatment plan that's specific to that person.
That makes so much sense. I mean, we all have unique features, so we all require a unique approach. Okay, one last question on this. What happens after treatment? Anything that patients should consider or avoid?
This is super important to know even before getting treated. Patients can experience common side effects like swelling, bruising, or discomfort after treatment. But remember, most side effects are mild to moderate and last for 30 days or less. I recommend that patients take it easy for 24 hours after their treatment. It's best not to schedule that first date or big work meeting immediately afterwards. Patients should avoid massaging the treated area, applying makeup, strenuous exercise, extensive heat exposure, and alcohol for at least 24 hours following the treatment. As always, it's best to consult your licensed specialist on any specific guidance they may have.
Okay, so we have your permission to relax.
Yes.
One question that I know a lot of people are curious about is how long filler lasts. What can you tell me about that?
The duration really depends on the specific filler and the area being treated. For example, JUVÉDERM VOLUMA XC provides results that last up to 2 years in the cheeks with optimal treatment. The JUVÉDERM VOLBELLA XC in the lips can last up to 1 year with optimal treatment. That's something patients should always discuss with their injector during their consultation.
And what about safety?
This is super important, so I love that we're talking about it. I choose the JUVÉDERM Collection of Fillers because it has a proven safety profile and has been widely studied. It's actually appeared in over 300 clinical studies. However, when approaching treatment, my biggest piece of advice is to look for qualified providers who can recognize and manage complications early in the rare event that they do occur.
So it sounds like it's not just about the product itself, it's also about making sure that you're in the right hands.
Exactly. Finding a licensed injector that has a lot of experience is so important because you want to find someone you trust, who's going to be honest with you, who can say no when it's too much, and who's going to appreciate your unique facial features, not just put you as a blueprint that they have to replicate.
So we've talked a lot about going to the right injector, but ultimately, how do you choose that right person?
You want to find someone who you feel comfortable with. That's why I think the initial consultation is very important. You want to make sure as a patient that your doctor is listening to you. When I first see a patient for a consultation, I take time to listen to the patient to not just know what they want to fix, but to get to know their story. Where are they from? What's their history? What's their culture? What are their aesthetic preferences? And what are their fears about cosmetic procedures? And this is all important information when you're coming up with a treatment plan for a patient that's comprehensive. We're lucky in New York City to have such a diverse patient population. So over the years, I've been able to appreciate different aesthetic preferences based on, ethnicities and cultures.
So for my friends and for readers who are in my DMs asking, who is legit? Where should I go? I don't know where to start. What advice should I be giving them?
I think finding an experienced injector who knows facial anatomy, who's licensed, is important. But also just going in for the consultation and seeing what the plan is, what they do, how they listen to you is very important.
And I know that the JUVÉDERM collection has some great resources to make that possible, right?
Exactly. For patients, the Allure program, which is JUVÉDERM's aesthetics loyalty program, makes it easy to find injectors in your area.
That's so important. I mean, at Allure, we're very anti-gatekeeping, so to have a resource like that is so valuable. Dr. Chang, thank you so much for this insightful conversation.
Thank you for having me.
And thank you for watching.
Keep watching for important safety information. Not for people with severe allergic reactions, allergies to lidocaine, or the proteins used in Juvederm. Common side effects include injection site redness, swelling, pain, tenderness, firmness, lumps, bumps, bruising, discoloration, or itching. There's a risk of unintentional injection into a blood vessel, which can cause vision abnormalities, blindness, stroke, temporary scabs, or scarring. Talk to a licensed specialist to find out if it's right for you. For important safety information and to find a licensed specialist, visit JUVÉDERM.com.